Dear friend, hello. In this video, I'll explain what cancer is, if you should fear it, and how it's treated today. Be sure to watch this video until the end, and you'll fill a lot of gaps in your knowledge about oncology. They will be closed. Many of you likely link cancer to an unhealthy lifestyle. But in our institution, we have pediatric oncology. Pediatric oncology, where the parents don't smoke, the parents don't drink, everything is absolutely fine. They took good care of their child, but it still happens. There are certain types of cancer that only occur in children. There are types of cancer, for example, prostate cancer. It is believed that if we live to be 150 years old, 100% of people would get prostate cancer. And we don't cure all types of cancer. Many people die with cancer inside them without even knowing about it, and they die from completely different causes. And that's why, in some countries, certain tumor markers have been removed from mandatory screenings for elderly patients, because they are a reason to find an incidental cancer in an elderly person, which would force them to undergo some kind of treatment, even though the problems from this treatment will be much greater than if you just leave the cancer alone. Because in our minds, cancer is always something that develops rapidly and will definitely kill you. But I can tell you honestly, many types of prostate cancer that occur in a person at the age of 75, 80, they won't lead to his death without any treatment at all, even possibly within 5 to 7 years. A sober attitude is definitely the right approach. The first thing you need to understand is that even if you live a healthy lifestyle, if you don't smoke or drink, it absolutely does not guarantee that you won't get cancer. If you look at my department and other hospitals, most of the patients are, of course, people with obesity, smokers, those with poor diets, unhealthy lifestyles, and not very good genetics. But among them, there are also athletes. There aren't many, but there are people who are devoted to a healthy lifestyle. So, even though you eat right, don't think that this story, this video, isn't about you. And you don't need to know. You need to know this specifically for a sober perspective. We're all used to hearing cancer, cancer, cancer. In reality, there are many types of malignant tumors, and cancer is just one of them. For example, sarcoma. It may not seem as scary, but some of you might know it's a type of malignant tumor. And there are many of them. And why did I make this video? Because you often ask in the comments, what about my grandfather? What about my grandmother? What about me? My friends, listen carefully to what I'm about to say and you'll understand why I made this video. The question you ask most is, can cancer be treated? Of course it can be treated, and many types of cancer can be treated. For some reason, you associate getting cancer with it being only a matter of time before someone dies. That's absolutely not true. How long you will live and what you will die from, whether it's old age, some kind of injury, or you just won't wake up in your sleep at all. After you've already developed cancer, it will depend on A, what stage the disease was detected at, and B, what type of cancer it is. There are many kinds of cancer. There's blood cancer, there's soft tissue cancer. If it's detected at the first stage, then the prognosis, of course, will most likely be good. For example, here's a simple example. Kidney cancer. If you have a 2,1 1/5 inches mass on your kidney, we see on the computed tomography scan that it's a tumor. If we remove it within healthy tissue margins, then most likely you'll die from a completely different disease someday far in the future. But naturally, when the mass is huge, when there are already metastases throughout the body, even if we remove the main tumor, unfortunately, these metastases will still be fatal for the person. So if trouble suddenly knocks on your door, don't lose your head. Don't panic. Modern medicine can handle many situations. Chemotherapy, how effective is it? What is it? Chemotherapy is a treatment that is usually administered through intravenous drips to a person in order to kill cancer cells. Yes, indeed, what you see in movies, hair falls out, skin peels off. These are the side effects because chemotherapy affects not only bad cells, but also good cells. That's why people's hemoglobin drops and their skin gets worse. In other words, all rapidly dividing cells start to suffer. And that's exactly why, for example, after chemotherapy, sometimes people become infertile for a year, 2 or 3. Then everything recovers. Not all cancers are sensitive to chemotherapy. We sometimes remove the main tumor, treat metastases with chemotherapy, and in some tumor types, we know a specific cancer will develop. For example, we are very grateful. Semenovaya, this is testicular cancer, and large masses, huge metastases, respond to chemotherapy. Even if someone comes to us with stage 3 or 4, We remove the testicle, give chemotherapy, and still have a high chance of a good result. For example, kidney cancer isn't sensitive to chemotherapy, and if surgery is not performed in time and the person develops metastases, then we won't be able to do anything about these metastases, unfortunately. Some drugs slow their development but don't eliminate them. The same applies to breast cancer in men, breast cancer in women, or prostate cancer. If metastases have occurred, then we're talking about quality of life, about life expectancy, but not about recovery. We help the person, but don't cure them. But if the breast is operated on in time, if you regularly do mammography, if you regularly do ultrasounds as indicated, if you monitor your prostate, for example, by taking a prostate-specific antigen test once a year, after the age of 40, or by doing ultrasounds. So, if you detect this tumor in time, the chance of a cure at early stages 1-2 will be about 90-95%. Don't think that just because you had nothing last year, something can't suddenly flare up this year. Cancers grow slowly. For instance, kidney cancer may increase only a few millimeters each year. And regular checkups. So why shouldn't everyone get them? Or what type of checkup should you have? Well, that's like if your neighbor was struck by lightning and now you don't go outside when it rains because you think you might get struck by lightning too. Statistics guide our actions. For example, we only check the lungs if you have a long history of smoking. As for the kidneys, we don't check them either, unless you have some kind of hereditary predisposition. It's the same for many other organs. That's why there are standard examinations, psychological ones that we recommend, and there are things that we don't recommend. So, what should you do to detect everything in time, not miss anything, and treat almost any disease promptly? Let's review the most common cancers and their examination algorithms. As an oncologist, I believe leading a healthy lifestyle and having regular checkups are most important to minimize risks. After the age of 40, men should have a prostate-specific antigen blood test. You can start as early as 35. If you have a family history of prostate problems or cancer on the male side, you should have a prostate-specific antigen test once a year. This tumor marker gradually rises if there's a risk of prostate cancer. It won't happen that your tumor marker is normal this year and suddenly 10 times higher next year. This cancer grows slowly, so regular tests will catch everything. But often patients come to me for a consultation, I give them a list for hormones, and they show me at 20, at 25, a blood test for prostate-specific antigen. This is not necessary. That is, at 20, 25 years old, I don't see much point in taking a prostate-specific antigen test. Each age has its own types of cancer, and prostate cancer does not occur at a young age. Second, what about other organs? Basically, an ultrasound of the abdominal organs is enough. That's the liver, pancreas, abdominal cavity, pelvic organs. Usually, doing an ultrasound once a year is enough to detect any new growths that are already significant in size. This greatly reduces the risk that something will show up, as they say, when it's too late and symptoms appear. Because often patients who come to us for treatment, they get treated when nothing is bothering them. Last week I performed several kidney cancer surgeries. I removed a kidney from one patient and saved the kidneys of 2 others. It all depended only on the stage, and none of them had any symptoms. And the patient I'll be operating on next week is concerned about blood in his urine. But in that case, the stage is completely different and their prognosis will be very different as well. So don't be surprised if you're sent for an ultrasound or advised to have one once a year, even if you don't have any symptoms. If something is bothering you, that's already a definite reason to go get checked, to get examined, to look into it, and not to wait for it to go away on its own. They say a good knock always shows itself. Still, you shouldn't joke about your health like that. If you have any complaints, be sure to go get checked. Third, should you get your lungs checked? In my view, only smokers need to get them checked. If you're not in a risk group and don't contact dyes, you don't need to do it. Regarding tumor markers are not all specific, unfortunately. I would even say most of them aren't. What does that mean? It means you can't just take all the tumor marker tests and be sure there's no cancer. Because a tumor marker might not increase even if there is cancer. Here's a simple example. Testicular tumor. 2 identical patients both have an enlarged scrotum from a tumor. For one, the tumor markers increased dozens of times. For the other, they're normal. The reason is that different tumor types exist, though both markers relate to testicular tumors. So, Normal tumor markers don't mean you're healthy, but high tumor markers don't necessarily mean you're sick either. Let's say prostate cancer, prostate-specific antigen increases, but prostate-specific antigen can also rise with inflammation and prostatitis. So, if you're getting tumor markers tested, what you definitely shouldn't do is panic and interpret the results on your own, or choose which tumor markers to test and make far-reaching conclusions by yourself. So don't panic. We never look at tumor markers separately. And for example, if you have a high prostate-specific antigen level, we will definitely check your ultrasound results and see what the size of the gland is. And what was the prostate-specific antigen trend? Because it can't increase 20-fold in 3 months. All factors are considered together. The tumor marker is just one more. What you definitely should do after the age of 30-35 is a gastroscopy. They now want to change the protocols, and there are two camps. Some say gastroscopy should be done every 3 years, while others just recommend it. If you are in a risk group and you are not Saeed, then you should do it once a year. I think that having a colonoscopy once every 2 or 3 years should generally be enough. Gastroscopy can be done every 2-3 years since it's simpler and doesn't require anesthesia. However, many people can't tolerate colonoscopy without anesthesia. Many ask that with magnetic resonance imaging, positron emission tomography, and computed tomography available, why not just scan the whole body with a magnetic resonance imaging? Well, first of all, that's not a guarantee that you'll definitely find some kind of neoplasm. Because if it's small, if it hasn't grown to the size that the resolution of the machine can detect, you might miss it. And the accumulation of various drugs is not always an indication for some kind of active intervention. Or you don't always need to sound the alarm right away. It could be a benign inflammatory growth. Because Companiem, for example, uses computed tomography scans directly. But it's relevant. In reputable places, positron emission tomography, computed tomography, magnetic resonance imaging, and ultrasound studies always state they are not diagnosis and require interpretation by the treating physician. So, the internet is good and the fact that you're watching this video is wonderful. But I really hope that if any problems arise, you won't try to self-medicate. But then why shouldn't we be afraid of cancer? Tell me, have many people died in car accidents? Quite a lot, and people keep dying. But for example, have many people died from food poisoning? Quite a few from alcohol, from tobacco. But why doesn't death from a stroke cause such fear? Why doesn't death from thrombosis cause such fear? Even professional bodybuilders inject many drugs and aren't very afraid of death. It's like if, God forbid, a doctor told you that you have a precancerous condition. Did you understand what I said? Yes. Lung cancer is inoperable, although both situations, given their strain, can lead to sad consequences. It's all because death from cancer is agonizing, and these people suffer, die, and go through torment. It's exactly this suffering that has made us fear cancer more than a heart attack, more than a stroke. But believe me, a person who suffers a severe stroke, whose leg or arm won't work, who can't speak or function normally, his life, to put it mildly, won't be any better. What I absolutely cannot accept, and what I truly don't understand, is when charlatans, fortune tellers, old women, and esotericists try to profit from such a terrible disease with their tricks. When miracle gurus say that all your illnesses come from some kind of resentment, that you just need to meditate, and so on. My friends, unfortunately, because of people like this who give false hope, people don't get treatment in time. And when they come to us, it's often already too late, because if they came in time, we could treat everything. Today, there are many different methods. Today, there are many different surgical and instrumental ways, including laser surgery and radiation therapy, and the most modern pharmacological drugs, which fortunately are also produced in our country, and in principle, they are no worse than their Western counterparts. Many people still think like it's the 90s. When they hear oncology or have appointments, they immediately ask, but what about Germany? What about Israel? For many years now, there have been treatment standards that are followed, and basically all major hospitals in our country work according to them. And these standards are the same all over the world. They are updated every year, and they are based on hundreds of thousands of treated patients and the results of their treatment. And these standards specify which type of cancer can be treated most effectively with surgery or with radiation therapy. How should this be done correctly? And that's why, when you go to a good facility, for example, the one where I had the Oncology department, you'll receive treatment that is identical to what you would be offered according to protocols in Germany or Israel. And that's why, if you have the mindset that in order to get qualified, quality care, you definitely have to pay a lot and fly somewhere. That's not true. Nowadays, oncology is treated for free, and it's treated well in our country. So I have a request for you. As you know, I have quite a large number of patients. The waiting list is currently about 6 to 7 months, but this is for appointments regarding hormones, which are done in private clinics, in the public clinic. I perform surgeries and take medication, but don't do consultations. Regardless of the day of the week, if patients are diagnosed with cancer and need surgery, I accept them for free and always do it without making them wait in line. So don't hesitate to reach out. I will always help you if you need my qualified, competent surgical assistance. I work as the head of the Department of Oncourology and Oncogynecology at the Federal Oncology Center of the RNCRR. A link to my website, where you can find the secretary's number to make an appointment with me if you need surgery, is provided. The consultation will be free and without waiting in line. Feel free to contact me, I will help you. And in the next video, my friends, I would like to talk in a series of videos, probably, about what medications and supplements are available. What are the ways to improve your anti-tumor immunity and minimize the risk of developing a tumor? So friends, subscribe to the channel, hit the bell, and you'll be the first to know about new episodes.